Each man's life touches so many other lives. Well, that certainly pertains to organ donation, doesn't it? 2 years ago, my husband and I were part of a 3-way kidney exchange at Northwestern Memorial. I gave a kidney, he got one. He didn't get my kidney, that's why it was a 3-way exchange. 3 donors, 3 recipients. It went to another person within our 6-person group. It's really nothing short of miraculous that 3 donors who were able to match up with 3 recipients who were not related to each other in any way. When you have something like that, I always think, gee, please make sure you get the right kidney to the right person. But it's really quite miraculous. All of the recipients had end-stage renal disease. My husband, Mike, had been on peritoneal dialysis for 2 years before the transplant. My recipient, Linda, had been on hemodialysis. The other recipient was at the point where he would have had to go on dialysis if he did not get a kidney in time. For Mike, the effects were immediate. His creatinine level dropped to a normal level within the first 24 hours after the transplant. They had to have him in ICU because it was dropping so fast. His color, which had been an ashy, grayish, yellowish beforehand, immediately became a rosy pink. He's no longer cold and tired all the time from the anemia that comes with kidney failure. He's no longer itchy all the time, also something that goes with renal failure. He kept asking me, "Are you using a new detergent?" "No, I'm not." "Why am I so itchy?" I mean, this went on for a number of months before he was diagnosed with kidney failure, and then it finally made sense. He no longer wakes up with nausea 1 hour after he falls asleep because of the pressure from the dialysate infusion. He no longer has to walk around with 3 liters of fluid in his abdomen all the time. He no longer has to plan his life around dialysis infusions. He was able to see his daughter graduate from high school and hopes to see her graduate from college in 2 years. We're planning a trip to the Caribbean later this year without having to arrange for a dialyzer and delivery of huge bags of dialysate solution. We're looking forward to swimming and snorkeling, which he could not have done on peritoneal dialysis, when I believe people on hemodialysis can't do it either. The gift from his donor has improved his life greatly. Even with anti-rejection medicine, overall he's taking quite a bit less medicine than he was before the transplant. He's able to eat pretty much what he wants without having to closely watch sodium or potassium. I mean, we've always watched our sodium, but many salt substitutes contain potassium, and that doesn't work either for people with end-stage renal problems. I know that for many people, the decision to donate is made when a loved one is dying. This happened 17 years ago to my mother. My father and my mother went out to breakfast one morning with some friends, as they had been accustomed to doing, and in the car on the way home, he fell asleep. Well, he never woke up. So in the morning, he was going out to breakfast with friends, and by the afternoon, he had a massive brainstem CVA, and my mother was approached by a hospital staff member about organ donation. I imagine the thought crossed her mind, what organs could you possibly want from an 87-year-old man? But she agreed to do that. Well, my father was a pastor, and he touched many, many lives in that capacity. And I hope that whoever got his skin cells will touch many, many lives as well. Thank you.